Some might not be familiar with the flags, pictures, and sounds with which we represented our homes. So let's put our home countries on a map. Awais comes from Pakistan and Joel comes from neighboring India. Pitch from Cambodia joined our group this week. Iqbal's home is Sudan. Hannibal and Solomon were our country experts from Ethiopia. Tolbert is our NGO representative from Zimbabwe. Nigeria is represented by Isaac and Ayudeji. Julia is the talkative Austrian, and last but not least, Christine and Ule are our great Norwegian teachers during the summer school. But this is only one way how we can look at it. Let's put the map into a development context. How would our countries look like if we squeeze or expand them according to the relative proportion of the world's population living there? Clearly, Nigeria and Ethiopia in Africa and India in Asia stand out. Let's play the same game for getting some insights on the importance of the Millennium Development Goals. Worldmapper.org used information from the Human Development Report of the UNDP from the year 2004 to generate the following maps. The sizes of our countries for MDG 1 show the proportion of the world population living in poverty. Attention shifts to India when considering the access of male over female enrollment in primary education. Taking a look at Goals 4 to reduce child mortality, Goal 5 to improve maternal health, and Goal 6 to combat HIV/AIDS, malaria and other diseases, every concern seems to be centered around Africa. In class, we learned about different databases, among others from the Institute for Health Metrics and Evaluation and the UN Population Division. This chart depicts the life expectancy at birth for our countries in 1990 and in 2013. Major improvements but also a striking cross-country inequality are clearly visible. Additionally, the figure highlights the major areas of new challenges or areas with major improvements in health. For our countries, we highlight HIV/AIDS and tuberculosis, diarrhea and lower respiratory infections, and cardiovascular diseases. All this analysis, though very important, can create a picture that development issues are separating us from them. But development is not about us and them. It's about all of us.
The Sustainable Development Goals are founded on the achievements and the critiques towards the Millennium Development Goals. The new goals must explicitly address sustainability objectives and the interconnectedness of social, economic, and environmental aspects. Our major focus was on country-specific and global challenges for achieving health targets.
Health and well-being of all as a cross-cutting idea in the SDGs will be instrumental to the achievement of these goals. Although inter-country convergence in global health is approaching, we advocate that intra-country efforts should focus on ensuring equity through a system of universal health coverage.
Not everything relevant is measurable. Not all necessary data are complete or correct. And we need to be cautious about its potential political abuse. Yet, measuring allows for cross-country and within-country comparisons, evaluation of progress, and priority setting for health policy.
Communication of strategies and achievement to the public serve and mobilize different stakeholders and rising fund. Therefore, there is a need for a set of goals, targets, and indicators to monitor progress. Yet, we need to avoid oversimplification of the complex problem of poverty.
People often think of health as only having access to health professionals and medical care. Being healthy is about more than visiting a doctor or a hospital. The determinants of health are the conditions in which people are born, grow, live, work, and age. They play a critical role in improving the health of an individual or a community and are shaped by the distribution of money, power, and resources at global, national, and local levels.
Average data measures at country level do not reflect localized estimates informing evidence-based decisions. Therefore, disaggregation of population health indicators by age, gender, and educational level provides precise and realistic evidence for policy advice.
The demographic dividend is the accelerated economic growth that could result from an increase in the working age population. With fewer dependent populations, a country has a window of opportunity for rapid economic growth if appropriate social and economic policies are developed and investments are made. Therefore, to leverage and reap the benefits of demographic dividend, investments in child health, education, gender equality, and skill development are necessary. Spending on health is an investment which can bring exponential returns. The economic benefits of convergence in health would exceed cost by a factor of about 9 in low-income countries and around 20 in middle-income countries.
Will foreign aid contribute to meeting the SDGs? Yes or no? Well, our key message is that foreign aid remains critically important only if it is well aligned with national level priorities, is transparent, and sustainably builds local level capacity for interventions beyond the donor. Universal health coverage is about ensuring that all people have equal access to quality health care, regardless of age, sex, income, education, ethnicity, or location. Improved health care must be the first priority for all national governments globally.
Inequalities that are unnecessary, avoidable, unjust, and amenable to positive human interventions are unacceptable. Equity remains a key ingredient to attaining sustainability in health, ensuring all people receive quality health services that meet their needs will catalyze closing the gap of health inequalities and inequities in this generation and beyond.
Well, poverty has been and still is a great challenge. But if we move together, if we learn about and from each other, we believe that the global goals for health are achievable if we only speak with one voice for sustainable development.